I'm going to call convene the meeting for our governance committee meeting today. And I don't think we have anybody to address for us. So we'll seek for approval for the minute. Any question, if not, I'd love to have a motion for approval.
Move to approve the minutes.
Second.
All in favor, signify aye. Nope, nobody. Opposed? Same sign? Nope. Okay, it's approved. We have probably a very, very small, short meeting today. So just want to let any items need to be removed or discussed before we go. Otherwise, we will go to our agenda. Everything looks good.
Can you repeat your question, please?
Oh, do we need to any modification or any problem with the agenda that we have today?
No, none for me.
So everything's good.
Yep.
All right, Colin, welcome.
Brief compliance, corporate compliance risk update. Walk through a few items here. Bring those quarterly to you. Thanks for watching from a compliance standpoint from the information security side of the house. Our MSSP audit RFP is still in flight. We've done round one, done round two. Our selection here is going to be imminent. This is the auditor that will provide the oversight of Cisco, the outsourced our MSSP. We'll continue to watch projects. So our cloud migration in Forward and Cisco. Take every opportunity I can to thank the board for funding and improving those projects. They are critical for us from an information security standpoint. So thank you. From a fraud-based abuse conduct standpoint, what we're looking at right now, modifier 25, as a reminder, we look at 25, 15, and next year fairly frequently to make sure that we're performing coding and billing with those particular modifiers, which are double billers, accurately, and documentation reflects. We've seen a slight uptick in usage of modifier 25, which doesn't mean there's a compliance problem, it just means it wants to look. And so we are doing an audit of that right now. Skin substitutes and chronic illness. These continue to appear periodically on risk assessments for compliance because there continues to be a trend of enforcement in the environment around these items. And I think what this is getting to in the current federal environment is kind of a big fish, little fish thing. We've got all big fish, and now they're circling back to get the lesser dollar amount, probably under $4.5 million folks that are in violation of these particular rules. And so we continue to see a lot of churn there. CMS changes to RADB auditing I put on here because I think there's some ancillary impacts. So that is actually an auditor auditing Medicare Advantage payments who are paid based on risk-adjusted HSC scores. And there's no way that those plans take a hit to their premiums without passing that on to providers like Tchd. So we want to look at specific chronic illness diagnosis and make sure that our documentation is followed up. I think all providers have a vested interest in doing so because we're not going to take the hit that the plans do. So we can make sure that what we submit is accurate.
What is the percentage of agreement that have downside risk? Or you know,
That would probably be a very specific question. I don't actually know.
For Thunderbird, about 0. We don't have any downside risk.
so it's all
Decided for quality.
okay. So we shouldn't have that much effect on their not RAF score, but for the what's the other word I was trying to use from for the MA plan.
We still need it for our star ratings.
Star rating. So it still does affect on their reimbursement. It's up to us. Okay. All right.
The other key focus we have is the additional compensation audit, which I'll talk about a little bit later. So the board's aware we're in stage 3 of our conflict disclosure process here. We've done staff, we've done the board. We'll get you your action plans here when Daphne gets back. And then the third is the provider level disclosures. We do this in 3 stages. We put providers last, so we can link up their open payments information inside of the disclosure platform. So it's really convenient for them to have accurate data. This is, as a reminder, the Sunshine Act requirement that requires drug and device manufacturers to report publicly the payments they've made to physicians. Those disclosed. That's all I have. Turn it over to Miranda.
Thank you. Well, I have the opportunity today to provide you some updates on enterprise risk management. And so our last assessment was conducted in September 24 as part of the fiscal year 24 evaluation process. You can go to the next. Oh, do I have the clicker? Oh, you're clicking for it. You want me to take it? Thank you. All right. The first slide on cybersecurity. So we get a resilient edge risk report. The latest one was run on June 10th. And we get this through our excess cyber insurance provider and is a key component of looking at our cyber risk management strategy. So that has revealed our top risk or threats are data breaches and ransomware attacks. And of course, the business impact on that is the interruption to our services, all of the requirements around any privacy breaches, legal and business interruption costs, and then harm to our reputation if we have one of those breaches, as we've seen with some of our peers across the country. We listed some of the threat mitigation and prevention strategies that we have here, which is ongoing review of our cybersecurity position through that Resilience Edge report. We have resources through our cyber providers, both primary and excess. And of course, we value our partnership with IT security and compliance for those threat assessments. And we will be having an upcoming cyber tabletop that IT is going to conduct. Next slide. Around workplace safety and violence prevention, our top risk and threats there. First one is violent or harassing behavior. That's by patients towards our staff members. The second one, staff concerns with unsafe work environment, has primarily to do with concerns around lighting, physical security, and things like that. And then we obviously have a high volume of patients experiencing behavioral health challenges. The business impact on that is there can lead to a perception of an unsafe work environment, although I've got some good news on that front later. And then staff injuries, which can lead to lost productivity and cost to the organization. So again, we're doing environmental safety assessments. One has already been conducted this year. Nicole Ferrer, although I think she has a new last name now, she's here. She and our behavioral health director, Amanda Schwang, along with the Workplace Violence Data Committee, are continuously evaluating instances. There's a Power BI dashboard that they have for event tracking and trending, and then heavily involved in de-escalation training to staff, primarily nurses. The other top risk for the organization that was identified through the risk assessment process is financial sustainability. So obviously, and Kim spoke to some of these earlier today, but rising labor, supply, and equipment costs, particularly with the tariff situation, lower government reimbursement rates for healthcare services, decrease in taxes and other financial resources, and then talent retention challenges. So again, it can impact our services that we provide patients and impact the resources we have available to provide the services. So we're looking at inventory optimization strategies, productivity management, leveraging our IT service for efficiency opportunities, and identifying and working on department-focused waste management initiatives. In terms of some other updates that Daphne wanted to provide to you all, we'll go through these quickly in the interest of time, but some workplace violence prevention performance metrics. Huddle debrief is something that occurs after an incident has happened. The goals is to have 75% of those completed within 48 hours and 100% completed within 10 days after an event. We're seeing an uptick in being able to meet those goals and have identified some challenges around the fact that it can be completed in Midas, but a lot of managers are still continuing to utilize paper. And so we've identified that and working on re-education efforts to improve those goals. Workplace violence training, we received a grant and we are training 50 staff nurses per month. We've exceeded our goal for the past 3 months, and training is scheduled, I believe, all the way through the end of September, and that's been a wonderful resource for us. And then this year, in addition to the annual training that employees utilize through the computer-based learning, oh, I'm sorry, can you skip us? There we go. We added 2 survey questions. And I thought this was interesting. So the 2 questions this year that we ask at the end for all employees to take is, 1, do you feel comfortable or knowledgeable with the reporting process for workplace violence events? And overwhelmed, it was a 98% number. And I just thought that was phenomenal. And the second question was, do you feel safe at work? And that was 96%. So we do have the raw data numbers, and there's obviously, we'd love to be 100% on both of those, but I thought those were really great results.
Hey, Ron, can I ask a question about
Yes.
the workplace violence training? Who's funding that grant?
Nicole,
This is
the state it's a grant, and we actually have a grant funded, not an employee, but a contractor on site that works on all of that. And I think it's been a wonderful response. It started out a little slow, but then the response by the staff to participating in the training has been really, really good.
Is participation voluntary?
I don't know the answer to that either. I'm looking to Nicole. I think it's mandatory. Yeah.
It is now.
But at 50 a month, 600 a year, we take what, 7 years to get through the entire nursing workforce?
And we are exceeding those goals at this point.
That's all they're paying for is 50 a month. That's all the grants for.
Right, but and also besides the nurses, it's specific to nurses, but we are including other people in that training as well.
So we know
it's-
how many have been trained today. Nicole, if you want to talk a little bit, because I think we're probably,
So the goal was for 15 nurses a year, but the data showed that there were other nursing services employees that were also on target for some of the events. And so we've expanded that and utilized the grant and paying for the 50 nurses a month, but we're exceeding that. But in April, in March, we had 59. In April, we had 114, and in May, we had 90. So we're about at the halfway mark for nurses for the year, the calendar year, and we are over 300 for staff total.
And what's our total number of nurses on staff?
I don't know.
Throughout the district, roughly, 4 nurses for the district within the house.
it's 25 across the district, including your community sites, which are also important from a workplace violence.
Yes, and these are not all just inpatient nurses that are being trained in this. This includes some of the clinic nursing staff as well. So some of the early on issues we had were just the staffing because they're shift workers. So 12 to 12, 12-hour shifts. And it was hard sometimes to get those, especially in the clinics. But we've had Saturday classes to accommodate those Monday to Friday schedules.
But it will take a period of years to get through the whole workforce.
We have one dedicated trainer. So yes, it's going to take some time for sure.
Okay, thank you.
And the training is specific to de-escalation around these efforts, correct, Nicole?
That's a good point.
Nicole, I
That's a
have a
good point.
question, Nicole.
I'll look into how we can, yeah,
I'm a little bit confused
enhance the
between,
training.
because workplace violence
Mhm. Yeah,
depends on which
Good point.
angle you're looking at, right? Do we know, I guess I'm confused with, is it with the training to de-escalate to deal with the patient? Or is it between another coworker or safety?
both.
Uh-huh.
So it's just about the communication between, it could be staff members or it could be family members of patients or it could be patients. And it's really geared at pulling your emotion back from the situation and assessing it and trying to figure out your safest way to keep yourself safe, them, and maybe even escape.
It includes staff on staff or staff on patient.
So security and all that stuff. Okay. Have you thought about putting on some kind of podcast or something for training?
We do a CBL, do we not?
We do,
Yeah.
we do the computer-based learning and then we do in-class trainings. These are all held in class. The company that we use is called Therapeutic Options.
Mhm.
And they're very based in understanding behavioral health situations and really de-escalating those. I don't know that we could do, a podcast, but we definitely have done, I do a lot of speaking at, meetings and things like that with the, units and stuff, just to kind of discuss it, brief discussion of.
We could do, I think we could.
Because
Yeah.
I'm concerned because I
I
want
am
to follow up
too.
on what
Blake said,
Blake
I am
said,
too.
right? Because sometimes, a little 1 or 2 minute on Instagram or whatever for internal use can go a long way because they see example.
Mhm.
So they recognize the pattern or something like that rather than classroom sometimes much harder to reach, right?
Yeah, no, I'm happy to take that back and talk with them about whatever.
Yeah.
Because I know that some psych, there are company out there that can sell that we can subscribe to that. Because I think it's outweigh any challenge that we have in the workforce. Because 2 or 3 years roll out or more than that, it's going to be
Yeah.
too
I-
late.
We've got to find a way to get it blasted out. Yeah.
Okay.
Thank you,
Thank you.
Nicole.
All right, thank you so much. Appreciate you. So we'll go to the workers' compensation slide. And so the two numbers here, the overall spend is dollars that are payments are on claims that are still open in fiscal year 25. So they may have carried forward from other years, but it's what we've spent in fiscal year 25 for those claims. Those include medical costs, income benefits, ancillary fees such as nurse case management, peer reviews, things like that. And then temporary income benefits represent 20% of that total spend. The top claims are what we are dealing with in fiscal year 2025, what claims we have had, and also not only the dollars spent, but what we have in reserve for those claims. So that number is 637,746 for the year. 5 claims represent around 23% of that total incurred cost. We've had a couple of workplace violence incidents, a slip, trip, and fall, and then a personal injury where an employee fainted this year.
Yeah, let me ask a question.
Yes.
Rhonda, so the bottom section, those are incurred claims, so those commenced in the current fiscal year.
Correct.
And the top section, this is like self-funded health insurance,
Those could be carried over from a number of years previously, but they've actually come to fruition and we've paid out on those.
so our total incurred claims today, which you said includes anticipated
Reserve.
reserve,
Yes,
is 637, and then of those, 5 claims would be about 125,000 or something, about a fourth of that.
correct. And that's where we're
60,000.
getting we've got a couple of workplace violence, slip and fall, personal injury, those in there.
So if 5 claims are about 160, the claims aren't really large, any of them.
No, and someone asked me the other day in executive compliance, I think Colin did, how these numbers, how these dollars are holding against previous years. And I checked with the team and they said it's been pretty steady for the past 4 years. So we haven't seen any big increase or decrease in these dollars for workers' comp.
Okay, thank you.
Sure,
I have a question for you.
sure.
Are we self-insured workers' comp?
I believe so. Yes,
Do we have
Yes.
stop loss?
I think, yes.
We do.
Yes.
You know what amount? that
I
is?
don't know what that amount is. I don't have anyone from that team here today, but I can check on that and
Yeah, we'd like to see what is it accumulated or not and all that stuff.
Okay.
Make better judgment.
Mr. Chair, I think Daphne once a year puts together
Yes, she-
in the fall,
Mhm.
a list of all of our insurance premiums. And I
Right.
think workers' comp stop loss is one of those.
One of those ones.
That who has to find it.
yeah, we can go back and look at that and then I can try to get an update and see where we are.
That sounds good. Thanks.
Certainly.
memory, Blake.
And then
That's why you vice chair.
legal claims is the next slide. And so year to date, you can see the dollars there. We had one medical malpractice case that settled for around 80,000, 43,000, and 2 employee lawsuits. One was in the $3,000 range and the other one made up the other amount. We've got 10 open claims right now and 2 lawsuits that we've opened in fiscal year 25. We've closed in fiscal year 25, 3 claims and 6 lawsuits. The top trends we're seeing out of those legal claims are premises liability, parking lot issues, especially when there's a heavy rain. And then some vendor safety practices that we've identified and are putting some mitigation efforts around. If, for example, if they have a big hose they're running to move water around, that creates some challenges. So we are tackling those.
Let me ask you, that parking lot issue of vendor safety, do we carry the burden or, because I know a contractor has insurance also as well and bonded also as well.
We do, and it depends on, it's project specific. Yeah. And we do work back through those. If it's attributable to someone else, we work back through that. Yeah, absolutely.
Okay, a couple of questions. If the claims don't rise to a lawsuit, I guess those are mostly property damage issues in parking lots.
Some, and then also some patient claims. Mhm.
But a claim is a formal process, but it doesn't, it's a lawsuit hasn't been filed.
Correct.
And
So
then
right now we only have the 2 open lawsuits.
the 2 employee lawsuit settlements, is that the total cost or just our legal fees?
Those were just costs of the settlement. Those do not include any outside counsel fees or
That's
anything
how
like
much
that.
is paid to the-
Paid to the employee. Correct. These numbers do not include for a claim also. This is for the hospital. In terms of mitigation, again, we're working with vendors. We're working through the Midas events. We have a legal claims manager that works very closely with our team. And then working with EVS specifically on some mitigation strategies within clinics and things like that in the hospital.
Question for you, and this may not be appropriate for open settings, so we can go into closed session if we need to. I don't see any HR related claim.
The employee
Including the,
lawsuits would up in that 43,000.
That's it? Okay.
For fiscal year 25. And then there are some open claims as well.
Is there a difference between assuming these are injury related or is that claim on other stuff? Because I usually see more.
Like EEOC cases. and things
Right.
like that.
Right.
Yeah.
And
Is it taken outside of this or inside?
I believe in terms of the year-to-date spend, we included those employee lawsuits. I am not convinced that because I think those numbers are low too, that the claims can include what our HR team be managing in terms of like Title VII and ADA claims and things like that. That may be separate from this. Yeah,
Okay, employee related stuff.
because I noticed that was low also.
But should it be part of legal tracking?
We do track it, yes, and we can definitely include that on the slides next time.
All right. Blake, any question, Blake? Thanks.
Of course.
That conclude your report.
That concludes my report.
All right, thank you so much. Thanks for sitting in for our
Yeah.
Senate Council also as well. Mr. Will. Yes, sir. Welcome.
So, Colin was kind enough to ask me to speak, giving up there for this audit of student members about this is threats. We could go through this.
Yes, sir.
My number one risk is associated with that legacy given the basis of the organization. It creates very good data environment. Combined with that, it's a very good cloud. It's significantly increased the complexity of which we do. So part of the mitigation strategies were the intersystems virus. It's finished.
May-
We'll be focusing on the enterprise plus strategy.
The other question, Will, is when you talk about bus, are you talking about components like switches and
No,
firewalls?
no, what I'm talking about is logic. The logic. So the traditional databases, which means that I create a pathway between each application.
You talk about API stuff? Okay.
So I create a single path between each application with data back. An enterprise database, the database basically has the logic that it's an ATT, but it moves that information to all systems. So that there was a change in the teams, I mean, that wants to do it per system.
So when will that be completely implemented?
About a year. The first stage is to do take the existing message and put it to the cloud and then go live with that. Open up in the time for even to because everything like probably wants to the cloud. We do the transition of the new environment is a curriculum strategy of backfill. So that we can have Epic up in operation first, and then you do the interfaces.
You can do the interface in second.
Yeah.
This is not a cyber risk. This is an efficiency risk, right?
It is a cyber risk in that variable. Some of the, it is a cyber risk and some of the open point dependency and how well done. Maybe there's a bullet.
So these are the point-to-point that we have control over, right?
Yes.
Like the IoT and all that stuff. That's a responsibility for the vendor that implemented it, or is it fall under us also as well?
And this is the last one.
The IoT stuff, the device sensor and all that stuff, that's still fall under us. Okay. Okay.
The second risk is cloud governance. So without cloud governance, and what I mean is just folks with everything, role-based compliance to compliance, the role-based access to compliance, to data ownership. I have migration risk and migration needs to be different breaches or other things to cost. We're not doing this alone. We have a third party that is helping us with the overall migration to the cloud. We'll focus on making sure we're meeting the industry best practices standards and having those all validated. AI security. 38 just in an article too long ago, 38% of AI could be decisions by could explainability or even FBA. So one of the things that we've done, particularly with the legislation that's coming out of the state, is get beyond the focus of wow, it's AI. So what does it do now? So we're going to focus on the government's processes now, better understanding what's the outcome, what's the traceability. Mr. Chairman, back to your point about the cybersecurity vulnerabilities, and our biggest vulnerability right now is the IoT devices. It's our TLS or sensors, et cetera. Here again, just finishing RFP now to be one of the IoT platforms that can stand address them. They're mainly proprietary technology. The issues, for instance, 5 TLS. TLS system control.
I see. Are we at the point where our vendor can be qualified for high trust yet?
Some of them.
Some of them.
The majority of our big vendors, not all.
Right. What about the vendor for EMR and EHR and all that stuff? Are they certified DAF by NCQA? Yeah. Sorry, what is it?
Epic. You're talking Epic?
No, for because if they third party, right, would they be certified with NCQA DAF, the data aggregator type thing?
Some of them are, we try to do that.
For NCQA stuff?
Of course, we have a lot of good systems that have been around for 12, 15 years.
Mhm.
They're managed with the standards a lot.
Thank you.
Power BI, risk, is interesting. Power BI, let's put in Power BI is a standard tool for business intelligence. It was properly configured. Part of the process of the two right now is 50 days, but we'll get to cloud later. So, when my mastermind was talent skills gap, we've got a period where we're going to be in transition of manage the old tribal knowledge. And then I've got an issue associated with new skill sets and how do I balance it. looking at the chart. Questions or concerns?
I have a question for you, because when you use LBI or some kind of report, especially around the finance area for patient billing and all that stuff, people sometimes send stuff, social security and all that stuff to email. Is it automatically encrypted?
We do 7 through the buildings, not secure. We can build our code. So we have 2 venues. We have
Mhm.
standard production and transactions that are encrypted and good.
Oh, I see.
We
Mhm.
have options to be able to, if I have to ad hoc send something, and then we have mechanisms.
To detect that? Oh, I see. Including fax scan type thing,
Basically, it goes out.
PDF file type thing.
Images as well as text.
Okay. That was most of the challenge I had back then with revenue cycle. People sending stuff, PDF file with social security and everything else.
And that was addressed
Okay.
2 months.
Right. So we have it pop up so that we can see everything that people sending across. But it's hard. Mhm. Okay. Thank you. Any resource that you need from us? We have a new CFO, so she have a blank check right now. She's in. Thank you, Will. And the next one, Colin, item 5. Please.
Bring forward for consideration for approval amendments to the common 8,000 policies for the finance program. This comes back about once a year.
Mhm.
It was initially approved in July of 2021. I brought it back about once a year since then. This particular package of updates comes in sort of 3 types. One is the DOJ and OIG have updated their compliance program guidance, and so we're aligning our program to that guidance. The second is just basic clarity, trying to make the document shorter and more easy to understand. And the third is there was some operational accountabilities for the compliance program function that should really be stepped back in an oversight role where the accountability for the operations belongs to an operational.
Mhm.
So I left my comments in the margins for you. So I know going through each and every one, if there's questions about specific ones.
I assume everybody read them. You have.
I only have a few questions, so this shouldn't take too many hours.
You're limited to 4, Blake.
Okay, page 90, and I'm referring,
You kind of like
has
the,
a page number at the bottom. Hopefully you have the same page number, but page 90 of the red line.
what is the page number? 13.
Okay, yeah, I don't have those page numbers. I just have the.
Yeah, I got you.
Yeah, you're right. This is page 13, but it's the red line, page 9. Section 134, you're talking about the last sentence, data analytics shall be leveraged to assess training, engagement, policy, accessibility, third-party risk, and overall compliance performance. Do you have a particular data analytics application in mind that you can use for that?
This is, we do have a number of data analytics platforms that are in the compliance program. So 9 or 10 that I could think of. This is just leveraging that, and it's clarifying language because the DOJ expects compliance to be prioritized with real oversight and not performative. And so there needs to be actual access to it. So we do have that. This is just like codifies that.
Okay. Page 93, which is 16 at the top. Section, that's a long section you got there. It's multi-pages. It's 2.1. I'll wait for you to get there.
On that.
Okay, the paragraph at the top that starts with the CCO is empowered. At the bottom, there's a red line that says the EVP, Chief Legal Officer, is empowered to independently conduct investigations involving the CCO or retain outside counsel. Is that referring to an investigation of you?
Yes.
For cause?
Correct.
Okay. And then the next red line that starts with on the same page, the CCO oversees and periodically reviews
Human resources.
human resources and or medical staff responsibility to screen all directors, officers, employees, contractors, and outfield medical staff against the LEIE. What are directors and officers in the context of JPS?
That would be directors would be executives, anybody director level above. And then really anybody, and then officers are the officers.
Is directors a common term we use?
That we common to the terminology used by the OH.
Okay, that's using their language. Okay, that's not referring to board of management.
No.
Okay.
Are you saying we were above the law? I'm just kidding.
Then, page, what is the LEIE? What does that stand for?
List of excluded individuals. So if you're excluded from Medicare or Medicaid, you get put on a list, and if you're on that list, you cannot work in a healthcare institute.
It's the blacklist.
Okay, skipping to page 104. Which it says page 27 at the top. This is a formatting comment. I think that that red line paragraph that starts with the EVP, chief legal officer, designate shall oversee. I think that's a second paragraph to 2219 and shouldn't be its own number.
We can make that.
That's part of the M&A paragraph section.
Catch.
Page 110. It says page 33 at the top.
Yes.
You've got that big red line at the top, 2.31, retaliation is prohibited. I think the second paragraph, if it's part of the 231, shouldn't have its own header. If it should have its own header, then you want to give it its own number, but that's just a formatting comment. Page 112, it says 35 top. Okay, it looks like what you're trying to accomplish here is have a division of labor between who creates the compliance program and who administers the testing of employees. And what you're trying to say is compliance develops the program, HR administers the program. You're not giving the test, but HR is giving out your tests, your training.
Correct.
HR
HR
is not
responsible for corporate education rolls up to the HR. And that is where those courses are.
But who develops our training for compliance issues?
For that, we,
Your department does.
so we're stepping into approving.
Pardon?
It'll be approval.
Well, and that's what I was gonna ask next. It says you're approving, but aren't you really creating and developing? I mean, is HR gonna be qualified to develop training for all of these complex laws you have?
Usually corporate education should do that. And then provide it back to us and provide guidance on that.
Is that how it works now?
Yeah.
Is it?
Well, it's a pre-canned developed course. We review it annually, provide updates, make edits, and then give it back to them for loading or annual learning.
So do they use subject matter experts for each of those? Okay, modules is what I thought. So security would do the active shooter. Is that what we're talking about? Okay. So,
Does HR outsource that work?
or you may have some internal, but yeah, some of that is
So you don't currently create
the
training
content.
modules for all of the
No.
any compliance.
No, we would decide the content that populates that. So that's
Then
where
you're gonna come
find
back by you for approval. Okay. And this isn't really a change in the way things go now.
I think the way it's worded, it makes it seem like we have more operational responsibility for that, but really, if I'm developing it and I'm responsible for it, I then can't provide oversight of myself. So we want to step that into, it's actually an HR function responsibility, because it's corporate education, we provide oversight of that.
Okay, page, 116 through 120, you've got a lot of red line sections you're taking out. Can you just explain what's going on there?
So when the OIG updated its guidance, it hadn't done 2005, I believe, it was very old. They sort of mapped it to what the DOJ had done, and in doing so, they eliminated what had been existing, which was a lot of some of this more detailed special areas of concerns and things like that. And I didn't particularly feel the need anymore to list each individual governmental entity that we will do a risk assessment of for the hospital and be more broad with the language. So it just makes the program shorter. And we still look at all of these things on a risk-based fashion, but they didn't even list it out with such specificity.
Okay. Page 123 says 46 at the top. You've got 5 categories of claims, compliance risks. Reminds me of the weather reports we get where they seem to go backwards on themselves almost, whether we're gonna get a tornado or not. But are these existing quantity breakpoints?
Yeah, that was, so when we do a risk assessment, you'll have your likelihood and impact. So your likelihood is your error rate, and then your impact is your dollar figure. And the dollar figure we can factor from claims, we put damages in there. We have a whole calculation built around that. If the end number is, say, damaging, then it gets scored at 12. But if it's very unlikely to happen, it's a 1, your overall score is. And so these are the levels that we use to quantify in the financial component. We have a couple of other different ways we can do that. But for the financial, that is what the board has decided are those trigger levels.
Are these existing breakpoints
Yes.
or proposed?
Yeah, these are interesting.
Okay, because it's red line here.
Yeah, I think it was, it's in there. It's just redlined out
Okay.
and moved up
And those breakpoints have been approved by the board at some point in the past,
as part of this compliance program
probably last year.
and the year before.
Are you happy with those breakpoints?
They seem to work for it. It works well. We have switched, client software vendors at one point and they didn't have, we lost some of the capability to do like a 1 through 12 calculation and shrunk it down. But this works well for us.
Do they fit some, DOJ guidance?
This is organizational risk tolerance.
I guess in a couple of cases, my risk tolerance is a little less than what we got here. I mean, I would change a couple of them down. I don't know how important these numbers are.
That's really a board preference on risk tolerance.
Well, I'll just throw out my opinion on 2 of them. The minor stops at 749,000. I'd have it stop at, under $500,000, so 499. You're dealing with the whole thousands here. And then the major is from 2 million to 9.99 million. I'd have it stop at 4.99 million. And then damaging would start at 5. We haven't had too many $5 million claims. I don't think we've ever had a $5 million claim.
So
Can't, I can remember under 5 million, but, that's just, Mr. Chair, my comment on those breakpoints. I didn't know if there was a legal need for them to stay like they are, but.
Kim, do you have any thoughts?
I think what my suggestion is
Sure.
call them.
Rhonda?
I know, I have no concerns.
So again, just to repeat, I'd
It's
have
not going to tie
minor
your hand.
stop at
It's not going to
499,000
tie your hand.
or under $500,000,
That's what I'm wondering.
and major stop at 4.99 million or just under 5. Damaging would start at 5 million.
Let's revisit that because I want to make sure that from an operating standpoint, there's no issue that
Yeah, sure.
tie hand of the
I want to
CEO.
make sure that we can, yeah,
Let's revisit that.
we can move these along without, yeah.
Yes.
Okay, last item, page 125, it says 48 at the top. We've got this, I'll wait till you get there.
Yep.
So we've got this overall corporate compliance program. I'm not sure I understand the purpose of the governance work plan, but one thing that struck me on it, and maybe I'm just misunderstanding it, You said at a minimum, it must include billing system risk assessments, claims accuracy audits, and medical necessity reviews by credentialed clinicians. And again, I may be misunderstanding the point of a governance work plan, but that seems like a very skinny list for all the risks you deal with.
That's in minimum. So we do bring, the governance work plan on an annual basis to this committee. It is usually the audit plan that we use. So the 3 audits we're doing in the close are part of the work plan for this year. We bring one every year and it is all encompassing, but it is risk based. So you'll see these areas. The coding is prioritized because that's the bulk of it, but it is also other efficiency type based audits, or anything that we consider. So it's not, shouldn't be considered that it's a skinny list. It's just at a minimum, it must contain these things, and it does.
So this is what I've always called kind of your annual audit plan.
Yes.
And you're calling it the governance work plan. Has it always been given that name?
Yes.
But it's gonna cover much more than this. I mean, do you think that it should have some other things like cybersecurity and HIPAA and,
Those are in the work plan. I mean, I can.
but they're not on at the admin, I mean, just, is there anything else you can think of that we really need to cover at a minimum besides those three? I just thought the list was short.
I can bring that language back when I bring the other one back. I'm going to take a look at some alternative language for that, make it more.
And leave it up to your discretion. When I saw it, I thought, well, we cover a lot.
It makes it in for sure, because as you saw in the risk register, IT, for instance, it's of waste interviews because it's the more.
For now, but I mean, 10 years ago, it would not have been.
No.
So I think these are things that consistently over history have been areas in which we have, have been common throughout all times. But to your point, this is the minimal, but depending on where we're at now in healthcare determines what gets added to this. So.
Dude, Dr. Boy, I hadn't really considered that before, but you're absolutely right. And this is always been a part of this particular program that I run, but probably has not been revisited with the thought process of how IT is done.
Well, just
I can
bring
revisit
this to mind.
that. It's a good call.
That's the end of my list. Oh, that's it.
Should that error rate be 5% or 10%?
I'm sorry.
What standard out there for 2.55, the error rate? 10% or 5%? Because the CCO standard for audit accuracy is 95 or above.
This OIG standard would be 5%.
And we allow 10.
So I would like to see better than that, and I think Kim wants to see better than I'd like to see.
And Colin, Daphne has reviewed all of these changes. Okay.
I don't know. I didn't get a chance to visit with her about that before she left.
Is she okay with all of these changes?
I went through legal review and so.
It did, yeah. One of the attorneys in our department reviewed it, and I think she had specifically recommended that Daphne review it. I don't know that happened before she left town, just with timing and everything. I just don't know.
From the process standpoint, Colin, is there any time sensitive here that we need to approve today, pending on that, or we can just wait for the next one? Because that's another 3 months, right?
3 months.
Okay. Is that okay?
That's fine.
Okay. All right. I don't think we have any other stuff except the in closed session, right? So we'll take a 5-minute break and then we'll come back. The last meeting was we're gonna go back to our regular session, and since we have no other item to discuss, the meeting is adjourned. Thank you so much for coming.
Thanks.